Hey everyone, it's Nurse Dani. Each week I receive questions and respond to them with either a written or video response. Here are answers to some of the questions you asked during this week. If you've been thinking about having a baby, there's a few things you should think about because there's certain things you wouldn't do when you were pregnant, but you also shouldn't do those things when you're trying to conceive, just in case you do get pregnant. So first of all, you should talk with your doctor. Go and have an appointment with them and they'll check out your entire medical history and also your current status to make sure that there aren't issues that need to be addressed. And if there are, they'll help you get things in check so that you're as healthy as possible going into this pregnancy. A few examples would be diabetes, thyroid problems, high blood pressure, and your weight. You want to start a pregnancy out at a normal, healthy weight. So if these things, you might need some time to get these things under control, and that's why it's good to think ahead and see the doctor before you're planning on having a baby. Other things to think about while you're trying to conceive, you should take a prenatal vitamin each day, one that has at least 400 micrograms of folic acid in it because it helps prevent certain types of birth defects, specifically spina bifida. Also think twice about everything you put into your mouth. Over-the-counter medications, prescriptions, and herbal supplements. And be sure to check with your doctor if you're trying to conceive, because again, if you're trying to conceive, you might possibly take it early on when you didn't know you were pregnant, and you want to avoid that if it's not safe for pregnancy. You mentioned that you're 7 weeks along, and first of all, congratulations on your pregnancy. You want to know if it's okay to sleep on your belly. And no matter how far along you are, it is best to avoid putting excessive pressure on your abdomen. And if you laid on your belly for a little bit of time right now, it probably wouldn't hurt anything. But looking forward to the pregnancy, it won't be possible to lay on your stomach. And so if you're a stomach sleeper, start sleeping either on your back or even better on your side. Because looking forward in pregnancy around 18 to 20 weeks, your doctor is going to advise you to start sleeping on your side. And the reason for this is that your main arteries and veins run through your trunk. So if you lay flat on your belly at a certain point in pregnancy, which is about 18 to 20 weeks, the growing uterus and baby are big enough to compress those vessels, and it can cause your blood pressure to fall. And this can also affect blood flow to your baby. So at night, especially if you've been a stomach sleeper, get a pillow and stick it in between your legs and kind of sleep on the pillow on your side, if that makes sense, and that might make you feel secure like you're sleeping on your stomach, but you're not. And you can also put something behind your hip on the other side to keep you from falling flat on your back at that point in pregnancy when you shouldn't be flat on your back. Roll up a blanket, put a pillow there or something, and that should keep you tilted. You mentioned that you have a 1-month-old that is sleeping 5 to 6 hours at night and has never really wanted to eat every 2 to 3 hours during the night. And as long as your baby is happy, healthy, and gaining the appropriate amount of weight as determined by your pediatrician, then you can just consider yourself one lucky mama. Most babies do come home from the hospital and they need and want to eat every 2 to 3 hours, but you mentioned that your baby will eat frequently during the day and then go 5 to 6 hours at night. I call it the pitcher principle. Imagine a pitcher of breast milk and your baby has to drink that entire thing in 24 hours. And some babies drink small amounts frequently throughout the entire 24-hour period, and this is common for babies to drink 2 to 3 ounces every 2 to 3 hours for the first 4 to 6 weeks of life. But then after that, their tummies start to get bigger, they start to have a sense of circadian rhythm and sleep for longer periods at night, and so they tank up during the day and need to eat less at night. And some babies do start this process a little bit earlier. But ultimately, your pediatrician is the one who's going to be able to give you the best advice about if your baby's eating and sleeping habits are adequate for them at this point in time. A lot of women get concerned if they feel like they're losing an excessive amount of hair, and we all kind of know what's normal for us. If you feel like it's excessive, there might be something behind it, but it can also be as simple as stress or lack of vitamins. But it's always worth bringing it up with your doctor if you feel like you're losing an excessive amount. So what is excessive? Really, we all lose 50 to 100 hairs a day. It's normal for us to shed. About 90% of our hair is in the growth phase, 10% of it is in the resting phase, and that's the hair that falls out and is replenished by new growth. Perform a test. Grab a chunk of hair and pull on it, kind of run your fingers through it. And it's normal if you get a few hairs, but if you're getting a lot of hairs out of that, then that could be considered excessive. And again, it's worth bringing it up with your doctor. In addition to stress and vitamin deficiencies, there can be hormonal imbalances, immunological problems, and sometimes infections that cause that. So after asking you more specific questions and performing an exam, they'll decide if further investigation or treatment is necessary for you. One of the first questions you have after you see a positive pregnancy test result is, how far along am I and when is the baby due? This is something that's determined when you see the doctor for the first time at your first prenatal appointment, which should be made by 13 weeks gestation, and you should plan on at least 13 weeks over the course of the pregnancy. Most doctors want to see you between 8 and 12 weeks, and at this point, they'll ask you about your previous menstrual history. And if you've been regular, then they'll probably just use your last menstrual period as a standard to determine your due date. If you have irregular cycles or you don't remember when your last period was, then the doctor will probably perform an ultrasound, and this is actually the most accurate way to determine pregnancy for women who have been irregular, because a fetus will grow at a very consistent rate during the first trimester, so they measure the size of the fetus, and if you're measuring 8 weeks, then you're 8 weeks along. Later on in pregnancy, the size of the fetus can vary depending on different pathological factors, but early on, it's pretty easy to tell how far along you are by doing an ultrasound. You wanted to know what you can take for gas at 7 months gestation, and I do recommend talking with your doctor about it, and based on their knowledge of your circumstances, they'll be able to tell you what you can do for it and what you can take. Generally speaking, it is normal to have indigestion and heartburn during pregnancy, and if you're experiencing this, then you can try eating more frequent meals throughout the day that are smaller and avoiding foods that you know cause excess gas. For most people, this is like carbonation. If you've been drinking a lot of carbonated beverages, cut back on that and drink more water. See if that helps. And then other gas-inducing foods are like broccoli, onions, beans, the list goes on and on. So see if you can peg down something that's causing the problem for you, take it out of your diet, and see if it makes a difference. I hope you found these tips helpful, and if you'd like to see more or have more questions ranging from preconception to pediatric health, be sure to like this video, like our Facebook page, and subscribe to our YouTube channel by clicking on this link.